Hi, guys. Dr. Pam, academic coaching for world changers. Let me share my screen with you and let's get into some questions today. Hope you can see my screen, and we're going to do some practice questions. But remember, one of the things that makes us very unique as a tutoring company is we do not think taking practice questions all day, every day is how you pass. We really believe, based on how we teach, based on research, empirical informed research says that the best way for adults to learn andragogy is repetition. We've done a lot of research on neuroplasticity, and we're trying to get those neurons to fire. So we're not trying to help you ever memorize, except for this semester of research. We want to help you recall. You've got some muscle memory because you all have a 6-year degree in this subject. So we're just going to pull up some muscle memory. And remember, we don't ever pretend to make you a better therapist. I say to my clients, so the minute you take the test, right, it says pass, and you leave the room and suddenly the gods dropped giftings into your lap. No. What makes you an excellent therapist is having a really good supervisor and experience. That's it. Our goal is to make you a better test taker and to understand that those two things are not related. So I hope you're seeing my screen because we're going to talk about how we always answer test questions. No matter what test you're taking from us, this is what we do. Okay, I want you to remember always, it's a reading test. Our research is based on years of experience. I've been in this field for 30 plus years. I've been an educator for 15 years plus. I really know how adults learn. You're going to meet with us one-on-one. We're going to figure out how you learn. But I'm going to tell you that most of us are definitely audio processors, and we're just not aware of it. So let's start off with reading. We're going to read out loud. The question says, you conduct a session to help a family understand the client's concept of their gender. You understand the client's preferred pronouns and provide a psychoeducation on gender dysphoria. What is the importance of using the client's preferred pronouns? What are they asking me? So we're always going to spend time in the question. What are they asking me? What KSA, what knowledge, skills, and ability am I supposed to know based on this one question? So this is an LGBTQIA question, right? So this means it belongs under social, cultural, and understanding diversity. Every test has the same questions under understanding diversity. It's really important that we learn the etic versus the emic viewpoint. The etic viewpoint says, I know American etiquette. And if you don't follow the rules in America, there's something wrong with you. Emic talks about the importance of understanding that the way that I see it is not right and understanding it from the client's viewpoint. There's no wrong or right. It's just different. Okay, so this is gender diversity. So A, it helps validate the client's diversity. B, it helps the client's parents become comfortable using the pronouns. C, it illustrates the potential associated with the transition. And D, it lays out the groundwork for fixing the client's dysphoria. So again, what I'm going to always do first is spend time in the question, understanding what it's asking. Now I'm going to read all four. Even if I think I know the answer, I'm going to follow the rules. A, it helps validate gender diversity. Maybe, I like that one. B, it helps the client's parents become comfortable using the pronouns. Now, I'm pretty sure always, the client is my client, right? I'm not necessarily trying to help the client's parents. I'm trying to help my client. C, it illustrates the potential challenges associated with transition. Maybe. And D, it lays the groundwork for fixing the client's gender dysphoria. I'm going to take D out for sure because we're not trying to fix anybody's gender dysphoria. Let's go back and make sure we understand the question. So if I am cisgender, the doctor says she's a female. I look at my body. I've got a vagina. I've got breasts. I look in the mirror. I agree. What the doctor assigned to me at birth matches up with how I see myself. That is cisgender. If I look in the mirror and I've got vagina and breasts, and somehow the doctor says she's a male, right? And I'm supposed to be a man, and I don't agree with what I see or what they assign me at birth, I'm unhappy with the gender. That's gender dysphoria. I'm unhappy with the gender you assigned me. But remember, none of these have anything to do with who I sleep with. It's not about sexual orientation. This is just gender. He, she, or they. If we go back, we know the term intersex, I-N-T-E-R, intersex, the term back in my day was hermaphrodite. We know that is not an appropriate term right now. So intersex and also androgyny means that I have both male and female parts. So it's not very clear with what I am. Gender has nothing to do with who gets my juices flowing, which is sexual orientation. So we're always going to follow the rules of the question. We're going to rule out two that don't make any sense. So my question says, I conduct a session to help the client's family understand the client's conception of their gender. I'm helping the client's family. Using preferred pronouns and providing psychoeducation, I'm teaching them about gender dysphoria. What is the importance of using the client's preferred pronouns? The term misgender means that I've said to you that, yes, I used to be Pam, but now I prefer that you refer to me as Michael. I would say Sam. That makes sense, Pam and Sam. But the goal is that I've said to you, please don't call me Pam anymore. You're misgendering me. My preferred pronouns, which used to be he, she, or her, maybe now are him, he, or him, or they. What is the importance of how using the client's preferred pronouns? I took out B and C. It helps the client's parents become comfortable using the pronouns. That's not the primary goal. It may be a goal, but that's not the reason. Remember, my client is the one that's got gender dysphoria. C, it illustrates the potential challenge associated with transition. Did I see anywhere in the question where he's changing or anybody's changing genders? I can't prove C in the question. All we're talking about is pronouns. It doesn't ask me about transgender. Transgender is changing, right? I believe that I was born in the wrong body, and any part of changing is transgender. And again, I only teach you the test. In the real world, we know that these may not be the best answers, but my only goal for anyone that ever listens to any of my YouTube channels or video channels or hang out with me is to help you pass the test. If you want me to help you become a better clinician, my rate is different than that, okay? Definitely, I've been in the real field for 30 plus years, and we offer lots of services. But these videos are only to help you pass a standardized test. And if you watch any of my videos, I will say that I work with the best and the brightest and the smartest people ever. All of my clients at a 4.0, 3.89, maybe you got a B in research and assessment. However, I'm not trying to make you a better clinician. I'm just trying to make you a better test taker. So I've narrowed down to A and D. I got down to 2. Okay, so I'm going to say always, prove it to me. Prove it to me in the question. In a vignette, it's easier because there's lots of lines. However, when I get that one line question, I'm lost, totally lost. But I always want to go back. Many people get down to the 2 and they're comparing the 2 to each other, but don't go back to the question. That's what makes Dr. Pam's prove it method the most successful. So now I'm between A and D. I conduct a family session to help a client's family understand the concepts of their gender. You use the client's preferred pronouns and provide psychoeducation on gender dysphoria. What is the most important use of the client's preferred pronouns? Am I trying to fix the client? Because I already ruled out and I got down to 2. I'm never trying to fix the client. There's something wrong with the client. Why would I do D? Of course, my answer is going to be A. It validates gender diversity. So if I use my client's they pronouns with the family, it really supports my clients. And remember, everything on the test is always about what's best for your client. Guys, I hope you found this video amazingly wonderful and helpful. Remember to subscribe to our channel and also follow up with us. If you're a social worker, if you're taking the master's clinical exam, if you're taking any of my drug and alcohol exams, if you're taking voc rehab exams, this question is on every single test. In order to be a good clinician, I have to understand the importance of diversity, which includes LGBTQIA terms. Hi guys, Dr. Pam. I'm saying goodbye, and I hope I see you in one of my live sessions soon. We believe in taking this test just one time, and we don't ever want to see you again.